Hello and welcome to another episode of Plastic Surgery 90210. We are currently on Instagram Live and today we're talking all about Vaser Hi-Def liposuction.
Yep.
Yay.
Let's do it.
Yeah. So you do lots of that.
Lots of
Vaser.
Yep.
But let's talk about the body parts that you do it on.
So Vaser has been around for a long time, and it's a really good tool to help melt the fat and to sculpt the fat that's around the muscles. It's really good on scar tissue, but we love it, especially on the abdomen. Using the Vaser for the ab, we can really sculpt out the six-pack, get you a nice rocking hot tummy, popping out all the six-pack muscles. We can also use it on the side of the chest for the serratus muscles, the ones on the side. Also the love handles, it just basically dissolves all the fat in that region. And then we can also use it on the arms to really define the arms, biceps, and triceps. And we use these techniques on male and female patients.
Some people think that Vaser is like the answer to all their problems, or liposuction in general is. Can you talk about who would not be a good candidate?
Yeah, so again, liposuction is ideal for patients with isolated areas of fat. Look, you know, I eat right all the time, I exercise all the time, but I just can't get rid of this little softball sized area around my belly button or in the love handles. What do? Liposuction is probably going to be your answer, as opposed to, well, doc, you know, I'm 5'0" and I'm 350 pounds. I think I need lipo. No, you probably need weight reduction, either diet, exercise, or maybe even a stomach procedure. So liposuction is for isolated areas of fat. Right,
because if you have already excess skin, and then you remove that fat, you're just going to be left with more excess skin.
Correct. The skin will be more sagging because it's lost that substructure, that support of the fat. So if you remove just the fat, you're relying on that skin to snap back. And if you are overweight or have a lot of redundant skin, stretched out skin, that skin's probably not going to snap back, so you probably won't be a good candidate for the Vaser.
Would you say that a lot of celebrities might low-key get Vaser Hi-Def liposuction?
Yeah, I mean, the industry, entertainment industry, movie industry is full of patients having plastic surgery, and they don't want the public to know about it because, you know, it's none of their business, number one, and number two, they don't want really to advertise that they've had procedures done.
But you think it's more common than we think?
Oh, way more common. Just think of the celebrities that get six-packs in 6 months. You know, can they really do it in the gym? No.
1 pack per month?
1 pack per month, maybe, but I doubt it.
Okay, so let's talk about who would be the best candidate. I know you said isolated areas of fat.
Yeah, so best candidates for Vaser Hi-Def, and we're talking about the six-pack abs, the rectus muscles, the six-packs on your tummy. Those are ideal for patients that, look, you know, exercise all the time. They spend many hours in the gym doing 100, 200 sit-ups a day. They do their obliques, they do the medicine ball, they eat a lot of protein, and they just eat right and exercise all the time, but they just can't get those muscles to pop like they want to. Those are sort of the ideal candidates for Vaser Hi-Def.
Okay, and if someone's trying to figure out if they should do regular lipo versus Vaser, how would they decide that?
Yeah, so when I consult with the patient, I ask, what kind of look are you looking for? Are you looking for just a flat abdomen and just getting rid of these pockets of fat? Or do you want a little bit of muscle definition or a lot of muscle definition? Most of my male patients, they're like, I want as much muscle definition as you can get. Get me a six-pack or more if you can. So on those patients, we're being very aggressive. We're doing a lot of Vaser. We're doing a lot of high energy melting of fat around the muscles to really make those muscles pop. Women on the other side may not want that sort of that Amazon look, that ripped, shredded abdominal look, and they want to maybe go for a lower key abdomen. Maybe they just want to go for a flat abdomen. Maybe they want the midline to be a little bit more accentuated. Maybe they want those 3 vertical lines. Rare but common. We have sometimes those physical trainers, female physical trainers, that do want those horizontal insertion cuts too.
Right. Is there a difference in recovery time for lipo versus Vaser?
Yeah, so everybody's a little bit different. Typically with the liposuction, the recovery is going to be about maybe 10 days, 2 weeks. And then the Vaser, sometimes about 10 days, 2 weeks. It really just depends on how aggressive I need to be with the Vaser machine.
And is it a misconception that people think that the six-packs that they see are made of fat?
Yes and no. I mean, some dermatologists, plastic surgeons, OBGYNs, when we take out the fat, they inject the fat into the muscle. To me, it never makes much sense by putting fat into the muscle. That just doesn't make sense. I don't do it on my BBLs, I don't do it in the anter-abdominal wall, I don't do it in the biceps and the triceps, but still, people do that. For me, it's more about the etching. So I don't inject the fat and I don't, for me, it's just melting the fat around the muscles.
Could injecting the fat into the muscles of the abdomen be dangerous?
As far as we know, no. Now, injecting the fat into the buttocks, yeah, that's a no-no. That's what's causing all these problems and conditions with the BBL. That's why sometimes the BBL, Brazilian butt lift, has been called the most dangerous plastic surgery procedure. Well, could be, but that's because we're injecting it into the muscle. I don't know anybody that injects the muscle anymore.
Okay, good. And I've heard you say before that liposuction is the most common procedure.
Yeah, it is. It is. It's the most common statistic procedure in the world. More common than appendectomies, hysterectomies, C-sections, tonsillectomies, everything like that.
More common than C-sections?
Absolutely.
Oh my gosh.
Absolutely, yeah. You can look it up statistically. Yeah.
Wow.
Yeah. Think about it. Men don't get C-sections, so there's doubles your numbers, right?
That's true. Okay. So plastic surgery can be for men. That's also something that, you know, has been changing over the past, like, maybe, have you say you've seen more male patients this year?
Yeah.
The past decade, I mean, than like before?
I think males seek out plastic surgery more now because they can see the results, and especially with Vaser Hi-Def liposuction, males love that procedure, and we can really sculpt out the abs with the liposuction Vaser.
Great. And let's see, someone's asking a question from our audience. We want to know, how long does the six-pack last?
It should last your lifetime. Now, you know, after the procedure, don't go to Krispy Kreme and just start going crazy. All right. The liposuction procedure is a tool. It's just to get you where you need to be, but once you get there, you need to maintain that. So we do the Vaser Hi-Def, continue exercising, continue doing your six-packs, continue eating right.
Right. I mean, why would you want to throw it all away anyway?
Exactly. So you should be able to keep those results for your lifetime.
You want to talk about what it's like to have a consult for a Vaser liposuction?
Yeah. So typically patients will come in and we'll examine the patient and get a good thorough history, medical history, past medical history, any of their medical conditions or problems. And then we'll assess what you are looking for. You know, what is the look you're looking for? Flat abdomen, more of a sculpted abdomen, more of an hourglass abdomen. I want the shredded six-pack abdomen with all the muscles popping. So, and then we decide what kind of surgery you need. And then if that is an agreement with you, then we go ahead and schedule the surgery. The surgery gets scheduled, and then before we do any surgery, of course, we're going to check your blood, EKG, chest x-ray, everything like that, make sure you're healthy for the surgery, and then we can proceed with the surgery. And then surgical date, basically you come in, we take a whole bunch of pictures, we feel where the muscles are, we mark out where the six-pack muscles are, and that's sort of our roadmap to find the muscles underneath when we do liposuction. So I bring you to the operating room, we start the IV, you go night-night, my anesthesiologist watches you the whole case, make sure it's nice and safe and comfortable, you're completely asleep, you do not wake up during the surgery, and then I get to work with my liposuction. First thing I do is I put tumescent fluid in there, so I float the tumescent fluid in there, and that basically minimizes the bleeding. It minimizes the pain during and after the surgery, and it also floats the fat. Now, Vaser liposuction, the mechanism, the way it works is it uses ultrasonic energy. Okay, and the way I think about it is, you know how whales can echolocate underwater? They're under there and they can echolocate in one area, and that sound wave travels for miles. You can hear whales underwater for miles based on the clicks that they make being carried underwater in that aquatic medium. So if you have an aquatic medium, sound energy can travel a lot farther. So when you're using the ultrasonic frequency, when it's in water or tumescent fluid, then it can have much more effect on that localized area. So with the tumescent fluid, when it's in that aquatic medium and you insert the Vaser, that's when it works the best. So you got to have that tumescent fluid in for the Vaser to work. If you don't use tumescent fluid, don't use water, or don't use our fluid, the Vaser is not going to work.
Wow, and that was our science lesson of the day too.
Yep.
Great, and what is the age range between your Vaser patients?
There's no real age range. It has to do with the health of the patient. Of course, we're not going to be doing liposuction on teenagers, okay? We're going to want you to be fully developed, healthy, everything like that. But then the upper range, we've done Vaser Hi-Defs in patients in their mid-70s because they were healthy. Now, if you're not healthy and you're in your 20s, I'm not going to do the surgery. But if you're healthy and you're in your 70s and 80s, it's possible we can do the surgery.
Okay, great. Wow.
Yeah.
Hot 70-year-old.
Hot 70s, yeah.
All right, and someone's asking if they could get Vaser with a tummy tuck.
Good question. So that has to do with blood supply. Now, when we do liposuction with a tummy tuck, we're always paying attention to the blood supply of the tummy. Now, when you make an incision across the tummy, you're relying on the blood flow to come in from the sides to the flap. Now, if you do liposuction in there and you kill those areas of blood vessels, you're not going to get blood flow to the tummy tuck, and that skin's going to die. So you need to be very careful and strategic with your liposuction when you combine it with a tummy tuck. So typically we can do liposuction with a tummy tuck on the love handle region and sometimes the vertical areas. But if you start doing the horizontal areas, you can jeopardize the blood supply and the skin flap on the abdomen can die.
Okay, yeah, that's risky.
Yeah, not a good idea.
Yeah, and people are wondering how many areas you could do at once for lipo. We've heard of lipo 360. What is that anyway?
Yeah, lipo 360 is kind of a vague term. Lipo 360 gives the impression that we're doing lipo all over the body. Exactly. Or is it lipo all the way around? Is it lipo tummy, hips, and backside? Does the backside include the upper back? Well, it depends on your surgeon. Does it include the arms and the thighs? It depends on your surgeon. So lipo 360 is sort of a vague term out there. But we isolate areas. Typically the areas are not the thing that's important, it's the volume of fat that we're removing. Are we removing a lot of fat from the tummy? Well, maybe we can only treat one area then. Are we removing a little fat from the arms and the love handles and the upper and the middle and low back and the inner thighs? Well, that's multiple areas, but we're removing a little bit of fat, so it's possible we can remove those. So it's not necessarily number of areas, it's the amount of fat that we need to take from an area.
Okay, great. Yeah. And people do combine Vaser with like some other procedures though.
Yeah.
What would be safe?
Absolutely. So if we're doing Vaser six-pack, you can combine it pretty much with any facial procedure. You know, rhinoplasty, lips, eyes, facelift, neck lift, things like that, neck lipo. You can combine it with liposuction of the arms, Vaser Hi-Def liposuction. That's a common thing we do, Vaser Hi-Def of the arms and Vaser Hi-Def of the abs. Sometimes you can combine the Vaser Hi-Def with breast procedures, breast implants, maybe even a breast lift. And then sometimes we can also combine it with the thighs, thigh lifts, thigh reduction, or maybe thigh liposuction.
And you have so much experience doing Vaser and traditional liposuction.
Yeah.
I'd say like Vaser alone, you've probably done over 1,000 cases.
Yeah, absolutely.
Easily.
I mean, you got to think of also the Vaser's been around since the late 1990s. I remember buying the machine in the early, I think year maybe 2000 and started using it. And a very, very good machine. I think it's on its third generation now. So in plastic surgery, in my opinion, you don't want to try the latest and greatest, newest thing. You want to try things that have been around for a while and really do work. Because in plastic surgery, you know, there are a lot of new machines that come out every month. Oh, they're doing this and there and they're getting these results. Well, we don't really know because we need a track record of this stuff. The Vaser's been around a good 20, almost 30 years now. It definitely works. No side effects, and it's a really good machine.
The Vaser stood the test of time.
Yeah, absolutely, absolutely.
Great, and that's so important for medical things.
Absolutely, yeah, medical devices. Yeah.
Medical devices. Thank you for watching. We'll catch up next week on arm lifts and reduction.
Sounds good.
Having a summer special, so you got to call the office to find out what it is because it's a real good one.
All right, sounds good.
All right, our office number is
310-859-7770.
Okay, and you could also DM us on Instagram at Dr. Katzen MD, and we could get you scheduled for a consultation that way too.
Great.
All right, Dr. Katzen, thank you so much.
Thank you very much.
We'll see you later.
Thanks for having me.
Bye-bye.
Bye-bye.